name is Amal Nirkadkar. I'm the CEO of Patient Prism. And in our studios today, we have JoAn Majors. She's an incredible woman, a certified speaker professional and an author of 4 books on everything that has to do with improving the practice of dentistry and how to get team members to really performing at their very peak. And when team members perform at their peak, everything good happens, right? My segment here is about really how do you, and we at Patient Prism, we look at phone conversations daily, over 8,000 a day, right? How do you engage a patient on the phone to kind of earn their trust right away? And you have a system in place. I'm excited to hear it.
Well, some of the things that you and I have talked about is we really believe that getting that a name is initially the most important, because then I can call you by name and connect.
Sure.
But I think in preparing for what's the data, I always think about how can I bring massive value. So as a speaker, I run that through a funnel. How can I bring massive value? Well, I think about as a team member, how can I bring massive value to the morning huddle? We use one question that I think brings massive value to the morning huddle, and it's, how do you like your information? And what we know is when you think about the 4 personality styles that on the DISC, the DISC profile system, the D's and the I's, we know, make decisions rapidly. They can engage immediately. They need no prompting.
Sure.
The S's and the C's are a little more reserved,
Sure.
not as quick to jump out in front of the car
Sure.
or say something that may be inaccurate or perceived differently. So one of the things that we teach is if you ask this, Amal, you have an appointment at 10 o'clock with Dr. Majors on Thursday. One more question I'd like to ask you. We like to ask patients, there's a lot of information about implants, a lot of information about sleep apnea, whatever it is that they're asking about. Do you mind sharing with me how do you like your information? And what we know is if you look at your watch and kind of close your eyes, how do you like your information? 3 or 4 seconds goes by and it's like that pregnant pause. So we say if they haven't answered, because my personality style or your personality style would say, sure. I prefer bottom line. I'd like to know what's in it for me, how long it's going to take, that sort of thing, right? We can answer the question.
Correct.
The other 2 personality styles, in an effort to not make them feel uncomfortable,
sure.
After about 3 seconds, I tell them to start with the one they're not. In other words, Amal, because we're on the phone, I'd say, in other words, Amal, some of our patients want bottom line. They want to know how much it's going to cost, how long it would take. And then we have other patients who really want more information. Sure. In other words, they want to know how much studying the doctor's done on this. They want a brochure if they can have one. They'd like to read before they come in.
Absolutely.
Which one sounds more like you? And then you just nail it, because if I can tell a doctor this in the morning huddle, they know I'm going to have a patient that they're not going to make a decision today, right? So I think it helps us serve them at a level that's higher than a lot of the questions that we ask.
Almost like a cheat sheet question.
It really is.
Right?
It really
because
is.
It tells you, because otherwise you could be saying all this stuff and the patient's glazing over that because they don't care about that.
Right. I really, I like it. I think it's when somebody's interviewing me for a speaking opportunity, I'll say, there's a lot about what I do in a 1-day program or in our 2-day program.
Sure.
Do you mind sharing with me? How do you like your information? So the systems that I teach apply to me in any relationship that I want to be respectful of the other person and that I want to keep for a lifetime. I think it's different.
That's the first thing, you identify
Sure.
what they need.
Sure.
And the second step you talk about is the concept of permission.
Yeah.
What's that?
Well, we do this engage, and there's input, apology, and permission. And so with input, I would ask you a question and you would say something that I really don't understand, or perhaps patients will say things because they read it on the internet, right?
Okay.
And instead of saying that really is not true, I would say, oh wow, help me understand how that relates to what you just shared with me, or tell me more about that. So that's my input. I want input. With apology, sometimes when we have a patient who's disrupted our schedule several times, or they don't understand and they're back in for their 4th cleaning and they still haven't had the treatment taken care of, we would do an apology and say, I need to apologize to you. Somewhere along the way, I failed to communicate the importance of that actual appointment.
Interesting. But as far as where's the permission? Who are you asking permission from?
The patient. Many times, I'll ask the patient, Jeff, I know that you're here for this too, because a lot of times what we know now is people come in for what their pain is.
Correct.
If you don't take care of their pain, you won't earn their trust.
Correct.
It's different than it used to be. So what we know is if we can say, I know that you're here for me to look at this one too. Do I have permission to share with you anything else I might see? Well, nobody's going to say, nope, just want you to look at this one tooth. I mean, they're not going to do that, right?
That's right.
And I mean, it can be used a lot of ways, but that's primarily how we use that.
And then the apology, you said in a way that you kind of, if the patient hasn't moved in the direction you want them to move in, you kind of apologize and take the lower road and say, by the way, what can we help you with? I know we apologize. We may not have given you all the information for you to make that decision that's going to improve that. What can we do? So that I think it kind of improves by taking a position of not this professorial position.
That's exactly right.
But you're kind of taking the lower road and then empowering the patient to make the decision themselves.
I always say it's disarming. For me, apology and permission can be very disarming because in a situation where it could go south quickly, you charge the cancellation fee. I mean, we could go into all the ways we use it.
Right.
But there's something that's happened. The apology for me is disarming. I say, you know, Amal, I feel like I owe you an apology. And most patients will go like, no, everything's okay, right? You have sharp instruments.
Absolutely.
You don't need to apologize. But if I apologize, then it says, you know what? It's not about being right or wrong. It's about how are we going to move ahead. And it works great with your family as well.
So these are like 3 engaging tools.
Yes.
Not engaging tools, I guess tools to have an engaging conversation.
Yes.
Is you first identify what you need.
Yes.
You kind of ask permission to share concerns. And then you apologize in a way to kind of communicate urgency.
Yeah.
Fascinating stuff.
Or get the relationship back on track.
Get it back on track.
Yeah, for sure.
Fascinating conversation.
Yeah.
Thank you, JoAn.
Thank you.
Thank you.